Massage analgesia works by activating multiple physiological mechanisms that reduce pain and promote relaxation. When pressure is applied to muscles and soft tissues, it stimulates sensory receptors that send signals to the spinal cord and brain, triggering the release of endorphins, which are the body's natural painkillers. These endorphins bind to opioid receptors in the brain, reducing the perception of pain and creating a sense of well-being. Additionally, massage improves blood circulation, which enhances oxygen and nutrient delivery to tissues, while simultaneously flushing out metabolic waste products like lactic acid that contribute to soreness and inflammation. Another key mechanism involves the gate control theory of pain, which suggests that the stimulation of non-painful sensory nerves during massage can close the gate in the nervous system, preventing pain signals from reaching the brain. This effect is further supported by the activation of the parasympathetic nervous system, which reduces stress hormones like cortisol and promotes muscle relaxation, easing tension-related pain. Moreover, massage helps break down adhesions and scar tissue, improving flexibility and range of motion, which can prevent chronic pain from developing. The combination of these physiological effects results in reduced muscle stiffness, enhanced recovery, and overall pain relief, making massage an effective non-pharmacological approach to managing pain.